Hello, Tanisha this side on behalf of Team KR, and after a lot of requests for NABH training session today, I'm presenting the same for you. So, what is the mean of QCI and NABH? QCI, Quality Council of India, NABH, National Accreditation Board for Hospital Healthcare Providers, is a body which included various interested ministries and stakeholders, including industries, was established to make suitable recommendations. In this body, they inspect to healthcare industries and done verification of their quality protocols. Why we are going for NABH? As per IRDA, Insurance Regulatory Development Authority standards, every hospital shall meet to NABH, National Accreditation Board for Hospital and Healthcare Providers. Entry level for providing cashless reimbursement facilities, but for CGHS, Central Government Health Scheme, ECHS, Ex-Servicemen Contributory Health Scheme, and many more government schemes. We need to go for QCI inspection. After inspection done by QCI, they will recommend our hospital to that particular department where we have to get impanelment. So, what is NABH? National Accreditation Board for Hospitals and Healthcare Providers. NABH is constituent board of Quality Council of India, QCI, set up to establish and operate accreditation program for healthcare organizations. NABH is an institutional member as well as a board member of the International Society for Quality in Healthcare. Okay, so here it is, Quality General. It is a journey of pre-accreditation, then progressive level of pre-accreditation, then accreditation, then CQI, continuous quality improvement. Scope of services. जो सर्विसेज हम हॉस्पिटल में प्रोवाइड करते हैं, that are scope of services. First one is general medicine, general and laparoscopic surgery, gynecology and obstetrics, urology, orthopedics, pediatrics, ENT. Out of scope services, जो सर्विसेज या फिर सुविधाएं हम हॉस्पिटल प्रेमिसेस में प्रोवाइड नहीं करते हैं, दैट आर आउट ऑफ स्कोप सर्विसेज. कार्डियोलॉजी, ऑन्कोलॉजी, नेफ्रोलॉजी, ट्रांसप्लांट सर्जरी. So, diagnostic services, laboratory, hematology, biochemistry, serology, histopathology, which are outsourced, microbiology, that is outsourced. Radiology includes digital X-ray, second one is USG. So, here it is, vulnerable patients. A patient who is not able to do his daily activities of living. Following some patients are also called vulnerable patient. First one is pediatric patients below age 16 years. Second was geriatric patients age more than 60 years. Third one, pregnant female. This is because of high risk of fetal during pregnancy. Fourth one is physically and mentally challenged patients. So this was about vulnerable patients. Now emergency codes. Hospitals and healthcare facilities utilize an internally recognized set of codes to prepare, plan, respond and recover from internal and external emergency without creating a chaos by announcing the codes to activate and alert the teams and other members of hospitals. So, these are the emergency codes. Code blue, medical emergency. Code red, fire, internal disaster. Code pink, child abduction, baby mission. Code purple, internal violence. Code yellow, spill management. Code grey, external disaster. How to announce an emergency codes. Following steps you need to follow for announcing an emergency code. First one is staff will call on emergency numbers, which will ring on hospital reception area or where PA system is located. Second one is introduce his or herself after making phone call. Third one, then have to say code with area name with floor 3 times. Okay, then we'll get a knowledge about triage. It is a process of quickly examination of a sick or injured patient after any accident or battle, so that those who are in the most serious condition, they can be treated first. So these are the criteria for triage. You can have a look on it. Now, employee's job description. Which work you all are doing related to your department, that is job description. Employees' rights. An employee shall face no discrimination in matters concerning employment and conditions of employment on age, sex, economic status, place of residence, religion, caste, physical ability or HIV/AIDS status. Second one is an employee shall be provided measures to prevent any injury or damage to the person or property of all healthcare providers during the course of his employment. Third one is to get remuneration of right time. Fourth one is avail leaves as per policy. Fifth one, right to know his or her job responsibilities. Employee responsibilities. First one, maintain co-worker relationships. Ensure confidentially at hospital records. Complete all duties assigned by reporting head. Follow no smoking and no tobacco policy in the hospital premises. Coming on time on the duty as per the shift timing. Be in professional attire. Avoid casual attire in hospital. General process for taking leaves. First one is leave application form has to be filled and sanctioned by immediate HOD director at least 24 hours in advance and has to be submitted to hospital administration office. In case of emergency, medical issue and information has to be given through telephone or message before 2 hours of shift timing and after, and joining back on duty. An approved leave application needs to be submitted to HR. Third one is for nursing staff, all leave application has to be approved by immediate in charge and matron. Employees grievance policy. An employee shall take up his grievance with his immediate superior, who will give a personal hearing and try to resolve the grievance at his level within 3 days. If the grievance is not satisfactorily redressed, the aggrieved employee may submit his grievance in writing to the HR department of the organization. HR will record his comments on the representation within 2 days of receiving the complaint. HR department must examine the matter expeditiously and if required raise the matter in grievance handling committee and then intimate his decision to the employee within 7 days of the receipt of the complaint. Grievance in respect of consultants and senior administrators will not fall within the purview of the grievance redressal committee. Occupation hazards. An occupational hazard is a hazard experienced in the workplace. Some example of occupational hazard: infection, exposure to hazardous material, needle stick injury, hearing damage or loss, physiological effects, work-related stress, musculoskeletal disorders, electric shock. Okay, now misconducts penalties, major punishments. Misconducts revealing confidential information, misrepresentation of hospital records, unethical, abusive conduct to patients, visitors, or employees, engaging in physical violence, violation of patients' right, chronic abstentions, possession of narcotic drugs, beverages or weapons, theft, negligence, gambling, sleeping on the job, any criminal activity, violation of hospital policy, incident of sexual harassment. Penalties: minor punishments, memos, fines, recovery from salary, withholding. Major punishment: withholding of promotion, compulsory retirement, termination, dismissal. So here it is, PPE, personal protective equipments. So during COVID-19, you have heard about PPE kits. So here it is. Gloves, cap, masks, TLD badges. So you can see that how PPE kit looks like. All nursing staff, OT staff, lab and radiology technicians, housekeeping staffs are advised to use PPE. NABH standards, patient-centered standards, access assessment and continuity of care AAC, care of patient COP, management of medication MOM, patient right and education PRE, hospital infection control HIC, management-centered standard, continuous quality improvement CQI, responsibility of management, facility management and safety, human resource management, information management system. Okay, then verbal order. An order which is being given over phone by consultant doctors. ये ऑर्डर वो होते हैं जो कंसल्टेंट डॉक्टर देते हैं फोन पर. First one is minimum orders. Write it in verbal order register. Read it back. Say yes if correct or no if incorrect and repeat. If receiving report, insist on reading back. Verbal order register to be countersigned within 24 hours. It should be documented on medical record as soon as possible. Patient and family rights and responsibilities. Patient privacy, dignity, confidentiality, second opinion, refusal of treatment, access to his or her clinical records, informed consent and decision making. Information and education about their healthcare needs to be explained, taught in the language format they can understand. Okay, so this is to you to be understood that diet and nutrition, disease process, complication and prevention strategies, infection control, or information on expected costs. So on the right hand side there is written name of procedure, reasons, complications, livelihood of outcomes, alternatives to the procedure, witness sign, reason why patient cannot sign, consent for blood transfusion. These are the information and education about their health care needs. You should mind it in. Okay, so now what is IPSG? IPSG 1. Identify patient correctly. How to implement it? Use to identifier, name and ID number, ID band or interview the patient. Okay, so IPSG 2. Improve effective communication. How to implement it? To implement it, you should be a verbal order register. IPSG 3. Improve safety of high alert medication. To implement, medicine labeled, stored at common location, cross-checked before administration. IPSG 4. Ensure correct patient, correct site, correct procedure, time in and out in OT. IPSG 5. Reduce risk of hospital acquired infection. To implement an keep hand hygiene. IPSG 6, reduce patient harm resulting from fall. To implement it, fall risk assessment and side rails. So this was about International Patient Safety Goal, IPSG. Okay, so full forms. MSDS Material Safety Data Sheet, HAZMAT Hazardous Material. So this sign, you have saw it, you have been seen it many a times. So here it is. And now Sentinel Event. A sentinel event is an unexpected occurrence involving death or serious physical or physiological injury or the risk thereof. Serious injury especially includes loss of limb or function. Near miss. All undesired events which could have led to harm, ill health or injury. Things which are caught before reaching patient. Requisites: know about NABH, ER codes, fire safety, Department of Policy. So these things you have knowledge in the session. And the medical record completance during admission history sheet, each column to be addressed with SNDT, sign, name, data, time. Reassessment once in a shift with SNDT. Each entry should have sign, name, date, time, SNDT. So here is the end of the session. Last but not the least, I want to tell you that you should follow our Facebook, Instagram, Twitter, YouTube, LinkedIn, WhatsApp, or you can mail us on krbusinesssolutions@gmail.com, or you can check our website on www.krbusinesssolutions.in. Here are our 24/7 helpline number 73740 4000405. So thank you so much. If you have any questions or you want to ask anything, you can comment it down or you can email us. You can have a look on our website or you can follow us on the social media platforms.